Today, WBAL-TV is taking part in the National Association of Broadcasters' National Day of Action. This kicks off the White House call for all Americans to get COVID-19 vaccine in the next month. By July 4th, President Biden has set a goal of 160 million fully vaccinated Americans, or 70% of all adults, people over 18. Joining us this morning via Zoom is Dr. Chuck Callahan, co-director of the Baltimore Convention Center Field Hospital and vice president of population health at the University of Maryland Medical Center. Good morning, Dr. Callahan. Thanks for joining us.
Good morning. How are you?
Doing well. So right now, the focus seems to be moving from mass vaccination sites to smaller community-based clinics. So how's the convention center shifting its operations now?
In a large way, we've already become a community site. We've been working at the convention center doing testing and vaccination since the 17th of June last year, almost a year now, doing mass testing first. We moved inside in November so that we would be able to take care of folks in cold weather. We began vaccination in early February, and we've watched the numbers scale down both for testing and for vaccination, both very important strategies as we go forward into this next year dealing with COVID. And so we're in the several hundred range for vaccination, where we had been in the several thousand range earlier last month.
And for some folks, just getting to a site is an issue. So how do we combat that?
The strategy has got to be, in healthcare in general, but in vaccinations and prevention, moving care to where the people are. And so there are great efforts underway, both from Hopkins, Maryland, the other systems in the city, to bring the vaccine out to where people live, whether it's congregations, recreation centers. The Baltimore City Health Department has really led the way in this. And we're also looking at the opportunities around vaccination in retail centers, just like the pharmacies have taught us over time.
And for some folks, there might just still be some apprehension about the vaccine. So how do you deal with that?
Well, I like the word deliberation. The people that I talk to, I think, are still very often deliberating. Lord knows, with some of our populations, certainly men and women of color, there's lots of reasons to deliberate historically, and I understand that. And I think that our job is to help people with the questions that they have around the vaccine to really get past deliberation. It's one of the three primary arms that we're going to continue with COVID. That is expert treatment of the disease when we find it, screening for the disease, testing, isolation, and quarantine, and then ultimately prevention. The joy of being able to embrace family members that we haven't seen for a long time is really within our grasp, and it's something I hope that we all embrace as Baltimoreans.
For those who have not been vaccinated yet, can you explain once again, why is it so important for them to get vaccinated?
I think that immunity to this disease, and look, it is a bad disease. I mean, people get very sick with this, and I think we forget that sometimes. We've had the honor of taking care of over 1,500 individuals in the Convention Center Field Hospital. I'm a lung doctor. I don't think I've ever heard people cough as much. So it is a serious disease. It's important for us to prevent it as a major arm of our ability to bring this thing under control.
All right, Dr. Callahan, thank you so much for joining us this morning. Really appreciate it.
Absolutely. Thank you.
And for the very latest coronavirus data or more information on where to get vaccinated, be sure to download the TV11 mobile app.